Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
Hello, and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I'm the prenatal and pediatric chiropractor here at the CAP Wellness Center, and today's guest is Carole Osborne. She is an authority in prenatal massage. She's been a body worker herself for over 40 years. She has a body working school that teaches prenatal massage to therapists here in San Diego, but those therapists go all over the world to share their work, and she also trains all over the world. So she is an excellent guest to really dive into not only the benefits of massage, but to answer some of the questions that keep pregnant women off the table. A lot of my patients ask these questions and wonder, how could I possibly get a massage at this stage of the game? I'm so pregnant. Am I going to be laying face down? Am I on my side? How does that work? Or, I've heard it's dangerous, that there's certain points that a therapist could hit and could induce labor. And Carole's a perfect person to answer those questions for you and really dispel those myths and give you the right facts so you can understand the benefits that you can have throughout your pregnancy for not only your own health and well-being, but for the health and well-being of your baby. But before we get into all of that, let me, as always, take a moment to hear a message from our sponsor, the CAP Wellness Center. Hi, it's Dr. Jay, and one of the things I love about working at the CAP Wellness Center is being able to play a role in bringing a baby into the world that much more safely, much more naturally, and much more healthy. It's something that is an amazing gift to give a child, to have them start off their life healthy without the stress and the trauma that can all too often be a part of the birth experience. So I consider it an honor to work with pregnant women to help them with that time during their pregnancy. And it is a privilege to be able to work with infants and help correct any distortions that might have happened through the birth process and allow them to start off their life healthy in alignment and in balance so that a health challenge doesn't hold them back from being all that they can be in this world. All right, and keep those questions and comments coming. We've been getting a lot of great feedback from you listeners. I appreciate that. Questions about episodes, but also some suggestions for topics you liked covered. So keep those coming. Send it to info@capwellnesscenter.com or through our Facebook page at the CAP Wellness Center. And as always, we appreciate your ratings and reviews in iTunes. And now let me introduce to you Carole Osborne. Carole is a San Diego-based massage therapist, author, course developer, and instructor of somatic arts and sciences. In addition to private practice since 1974, she has worked in osteopathic, psychological, and women's medical settings. In 1980, she began researching and developing infant maternity massage therapy protocols and instructional programs, and she's pioneered the reintroduction of therapeutic massage and bodywork to healthcare for the childbearing year. Over the years, she's trained parents, hospital association staffs, and over 5,000 maternity massage therapists and other professionals around the world. She's recognized nationally as the Massage Therapy Teacher of the Year and has authored 3 textbooks, including pre- and perinatal massage therapy. Her articles have been appeared in many professional and mainstream publications, and we are very happy to have her on our show today. So now let me switch over to my conversation with Carole Osborne. Hi, Carole. Welcome to the podcast.
Oh, thank you, Dr. Jay. I'm so glad to be here.
Yeah, I'm glad you're here too. You've come very highly recommended to me through the birth community, both here in San Diego and around really the country. I know a couple of massage therapists that have trained with you and are doing great work through your training. So I'm glad you are able to take some time today and share your wisdom and expertise for our listeners to learn all about massage. So thank you in advance.
Yes, indeed. Yes, indeed.
Well,
this is my passion.
Yeah, it truly is. I mean, just having read your bio and then also looking at your other career accomplishments, It's absolutely your passion. You're very accomplished. And, tell our listeners just a little deeper about how you got started in this work in the first place, way back in the 70s.
Yeah. So, way back in the 70s would have been when I got pregnant for my first time. And so, my interest actually initially came out of my own experience in my own growing body. And at the time, there was a total and complete contraindication of massage therapy when one was pregnant. And because I was a massage and bodywork practitioner myself, I was used to getting lots of regular treatments weekly, really. And so then I started, because of course I was going to be a good mother, I started observing that contraindication, and I wasn't even to 3 months or 4 months into my pregnancy when my back was complaining. And so that led me to become curious about really, well, what's the rationale behind this? Because it really wasn't explained exceptionally clearly. In fact, there was no real explanation in these old books about Swedish massage they were back from the 30s and the 40s, excuse me. And so I, along with at the same time I was pregnant, I had 14 of women in my community of friends who also got pregnant in that same year's time. And I also had an influx of pregnant clients into my practice while I was just getting pregnant myself. So I had both personal and professional reasons to try to research this, and that's what I did. I started researching it through medical libraries back in the old days of the card files and going in the stacks of
into real books.
Yes.
Wow.
Excuse me, and real journals. And one of my colleagues, her husband was a physician, and so we had access to medical library and nursing library, physical therapy, etc. So this was a great opportunity for us to research this. And I also had several other midwives and another physician who were also open to the thought that something might be off about this contraindication, because actually the more we looked at it anthropologically, we here in the United States at that time, 3/4 of the way through the 20th century, we were the aberration here. Something was off with us, because around the world and for millennia, there are traditions of some form or another of massage therapy, certainly skilled people who are skilled, their skills and their knowledge transferred generationally and through experience and study, that shows that this isn't just something that what a clever kind of frill to add to pregnancy, just like you might add a special kind of dress or some sort of accoutrements of your slings or the things that you carry your baby around, or the special kind of carriage, right? That there's really some real reason for how massage therapy in the form of skilled touch can not only make a pregnancy more comfortable for the woman herself, but it can actually contribute to the health and well-being of the baby and the development of really the family and the family dynamic.
And what were those contraindications that were back then keeping women from getting massage? What were they saying the dangers or risks were?
Well, that was the interesting thing. They weren't giving any reason for it, just
really?
that it was unsafe. And which, for me, anytime anyone makes an absolute about something, I'm always skeptical, whether it's a never or an always, right? So as the research that we did over about a year or two time matured. And in fact, there is a very real concern that it's because of a number of factors, physiologically, structurally, and just gestational development. There is a high likelihood that women will have pooling of their blood in their legs, in the lower extremities. And of course, swelling is what you see on the outside of that. And then oftentimes on the outside, what you're seeing is varicose veins. But on the inside, what's happening with the pooled blood that is has a little bit more of a tendency for any blood clots to form, to remain, to not dissolve so quickly, is that women can have blood clots in their legs. And so those are, of course, not going to create any major problem unless they are large enough that they are obstructing some major flow, and then they become really dangerous if they move from out of the smaller veins in the legs and get moving through the more they move from the calves, for example, into larger veins that are in the thigh, then it's easier for those blood clots to then just move further along and up into general circulation. But the first place that they will go, since they're in the veins, is they'll go into the lungs. And once they're in the lungs, they're the tiny, tiny little vessels in the lungs, right? So a pulmonary embolism, right? An area where the veins in the lungs are actually being cut off from blood flow because of a blood clot. So that's life-threatening, depending on how much of a blockage and how much of the lung gets obstructed. Now, that was never explained in the books, and what we learned as massage therapists in that period, it was just don't massage a pregnant woman. So what happened for me was then the evolution of, the legs and the lower back are connected, but they're not the same in terms of what kinds of concerns you need to have about that. And there are one of the things that can be difficult for consumers of massage therapy to figure out is there are so many different forms of massage therapy. There are so many different ways in which one can modify the speed, the pressure, the depth, the amount of movement, and the direction that one applies touch. And that isn't even giving you the variations of what part of your hand, your forearm, your knee, your foot, and the difference between when I do that and when somebody who's a very different body size or a very different temperament than I am applies that, right? So what I and the colleagues that I was working with on this, we devised over a good 5 to 8 years' time. We devised some more specific guidelines of what kinds of touch would be safe on the legs and what wouldn't be, and what part of the legs was safer and not, and then on up to the rest, through the rest of the body, so that most women can safely receive some kind of massage therapy, some type of therapeutic touch that will be beneficial to them and to their baby throughout their pregnancy if, and this is the big if the therapist is knowledgeable.
Right.
But if the therapist is not knowledgeable about the kinds of adaptations that should be done, then, in my opinion, women should be quite cautious about who is working on them and whether it's appropriate for and safe and beneficial for them to receive massage therapy.
Right, and I can speak to that in that a lot of the patients that I've seen, if they've had a massage while pregnant and they go to kind of more of a generic place, that it wasn't a specialist as a prenatal massage, thankfully, due to the massage therapist training, they tended to give a really light massage, kind of staying away from any kind of deep pressure. And while that might have been a safe route to go, just to be in a safe, protective way, it wasn't a great massage for the woman who experienced it versus the massage therapist that we refer to. Either they've been trained by you or they've been gone through your school of body work or had special prenatal training. Then they're getting a really good massage that feels really good, but is also very therapeutic, and they can rest on the table confidently knowing, okay, this person knows what they're doing, knows where to work, where to stay away from, and I can really relax now rather than wondering if this person really knows what they're doing. So that makes a huge difference.
It sure does, because, no client wants to, whether they're pregnant or not, no client wants to be injured or in worse shape by the time they get up from massage than when they lay down, right?
Right.
And fortunately, the risks of massage therapy are really kind of few and far between. But there are some real concerns, and for pregnancy, really deep work and especially on the inside of the leg, of the calf and of the thigh is probably, along with how much pressure and how pointed a pressure is being applied to the abdomen, are probably the two most important precautions for a therapist to know in terms of changing the depth and changing the speed with which they are working in those two areas. Now, lots of clients, lots of people have heard about that there are specific places on your feet or your ankles or places that, if you touch a pregnant woman there, that she could go into labor. And in actuality, if those places were as potent as many people are fearful of, I would be rich from just having a little drive-through concession where I could have women bring their feet to me and I'd press on those little places,
Right.
But that isn't how that works.
From those women that are like 41 weeks that are like bumping up against 42 and like, all right, I'm done.
I'm done. Or they're at 38 and they're done.
Yes. Good point.
Right. At least emotionally they're done, but actually, no, they're not quite done. The baby's not quite done.
Yeah.
Yeah. So those points, are areas where, for example, most women's feet are in desperate need of a good, safe massage on them, which would include a light stroking across the entire foot. It could involve ways in which the joints of the foot are mobilized and the ankle and the calf are stretched, and the muscles on the outside of the calf oftentimes get are really tight if the woman's arches have collapsed on the inside of the foot, and so there's a lot that the foot really benefits from. And then there are just a few of these little places on the foot, and they're very small because actually they're most potent when an acupuncture needle is delivered into that point. Mm-hmm. So even if I were to press with my thumb, for example, in the junction between the big toe and the next toe, way up after the long bones are, if you've gotten from the toes through the long bones to where those more chunky bones are, a direct pressure in that little V-shaped area is something that one would avoid, but even an an accidental push into that area with the side of one's thumbs. Those points don't actually work as a labor stimulation unless they are repeatedly pressed in a certain order with a certain type of, especially, it works especially well if someone is trained in how to interact with those points as like sensitive areas in a whole line of points, the acupuncture meridians. So sometimes women think, oh, I should not have my feet massaged. That's not true. Have your feet massaged for sure. But when a massage therapist is working on your legs, the pressure on the inside of the legs is really important because that's where blood clots could potentially be dislodged by certain kinds of pressure on the inside of the calf and the thigh. And so that should be light. But other parts of the legs can be deeper.
Mm-hmm. Yeah, so all the benefits that you would get even outside of pregnancy as far as, getting more relaxed, like reducing emotional stress, blood flow, lymphatic flow, all those things are even more important, really, when it comes down to it in pregnancy, just so the whole pregnancy can be more relaxed. And you can still get all of those if you're going to a massage therapist that, as we're saying here over and over again, that's trained in this type of massage to know where to work and where not to work. And so that's why we're such big proponents of massage. But I'm glad you're speaking to these kind of worries that women have, so that they can, really get some more work so they can feel much more comfortable during their pregnancy.
Right. And of course, the place where most women are very interested in having some work done is their low back and their hips. And these are areas that, for the most part, if the client is on the massage therapy table on her side, not in a cutoff out something, not for the length of what a massage takes, she's on her side. She's got her abdomen is really supported underneath, and her legs are aligned such that the weight of her leg isn't rotating her pelvis and straining the joints and the soft tissue that's already strained by the pregnancy. If she's positioned correctly and the therapist knows what joints and what soft tissue are most affected, then there's a tremendous amount that can be done with quite deep work, very, very deep work. Although I really recommend that the depth be moderated so that the woman is not in pain. Because if she's in pain, then that's stress. Pain is stressful. So there can be depth, especially if the therapist applies the pressure for that gradually with a kind of exquisite attention to the client's response to the reception of that pressure. Then you can get quite deeply into the gluteal muscles and into the muscles of the low back and do some fascial stretching and do some range of motion and some gentle undulatory movements that really can do a significant amount to reduce the kind of neuromuscular tension that builds from the extra abdominal weight, then pulling and shortening so many of the muscles on the posterior, on the back of the body.
Right. And I'm glad you mentioned the side lying position, because another question I often get in the office is the positioning on the table, where, women's previous massages were always, they were laying on their back for half of it and laying face down for the other half of it. And at 38 weeks, how am I going to, do that? But with the side lying position, and if you look at a prenatal massage therapist's room, it's full of pillows in addition to the table, to be able to prop the belly, the hips, the knees, the head, the shoulders, so that you're kind of like floating in this cloud on top of the table that can withstand the pressure as the therapist is moving really deeply. So it's definitely a different position than, kind of a traditional massage you might have had outside of pregnancy, but is the way that massage therapy will access it. So I'm glad that you touched on that.
Yeah. Yeah, and actually that positioning is there's a lot of things about that positioning. That the sideline position is the position that physicians recommend that women sleep in. They don't make any recommendations in terms of there's not any formal recommendations from the American College of Obstetrics and Gynecology on receiving massage. But I take from their recommendation that women sleep on their sides during their pregnancy, that their recommendation is then that you would have the person on their side for a massage. And many people are not side sleepers. And so one of the additional benefits that happens, I'd say good 75% of the time, the first time I put my client on her side and begin to get her positioned, I can almost guarantee you that she's going to say, oh, wow, I haven't been this comfortable in months. Or she's going to say, oh, what are you doing? I should sleep like this.
Perfect.
Right? She's recognizing how much more comfortable she is on her side. And so part of what many of us who are more thoroughly trained in prenatal massage, we consider ourselves to be educators, right? We're educators in that we're helping a woman to prevent or alleviate the kinds of discomforts that just come on a daily basis. And sleeping is one of those. And so we use opportunities throughout our sessions, depending on the client's needs, to help to educate them to prevent further pain or to reduce the pain that they're having. So this is a great example of that. So if I give her a little bit of instruction on what I'm doing to make her more comfortable, she can replicate that at home.
Right. And because that is a huge challenge, especially in the third trimester, of the kind of like third trimester pillow fight that happens all night long, like trying to get pillows in the right place. And then you finally get them in there, and then you got to get up and pee, and then you got to start all over again. So having a professional educate them about how to get to that right away would be extremely valuable. Tell me more about too, like when do you recommend women use massage during the pregnancy? I mean, my general answer to that would be like start as soon as possible and do it as often as you can possibly do. But is there something more specific that you'd like to recommend to our listeners?
Well, I would have to say that that would be true for me too. My recommendation, and knowing that that's not possible for many women, is that here's one guideline to go along. Most prenatal care is delivered, whether it's a midwife or a physician, is delivered on a monthly basis for most of the pregnancy. And then as that third trimester and those last few months or weeks, depending on the development of the pregnancy, that becomes more frequent. And so that would be one way to think of it is, well, I need more prenatal care from my midwife when I'm at 38 weeks than I do when I'm at 12 weeks, right? So that's one way to think about it. If as much as possible isn't really useful. I find that if I can see a client somewhere in the late teens to early 20s of the weeks, she's past the part where she doesn't feel so well. She's begun to get a little bit of physical discomfort and gets it that how she's using her body and the growing baby are affecting her back and her hips in particular and her breathing. That if I can work on her for a couple of times, say in week 15 through 20, somewhere in there, then there's a lot that we can do to keep her comfortable. And then I see her again in another 5 to 8 weeks, right? And then from there on, hopefully we're in more of an every 2 week kind of pattern.
Right. And I think coupling it or even putting it in the context of an essential part of your prenatal care changes the kind of paradigm of this prenatal massage is, as you were saying, like a frill, like it's just, it's something to pamper myself. If you got a gift certificate for a massage, you want to save it until the end type of thing, instead of, looking at the research studies showing that not only is, prenatal massage going to alleviate the muscle pain and joint pain, but it's going to help your breathing and digestion and sleep. It's going to improve the baby's health because you're less stressed and blood flow is increased. And I mean, if we're talking about blood flow too, we want the uterus getting all that blood flow ready for laboring time, so that can be quicker and easier. So it really isn't just something to, only be thought of as a treat. It can be something that can really benefit the pregnancy, your own emotional well-being throughout it, but then also for the baby as well. And that's what we want for the little kiddos coming in, for them to come in as easily and as naturally and as safely as possible.
Exactly. And with the maximum fetal development, right? So exactly what you were talking about that blood flow to the uterus. Most of us are aware of the whole concept of fight or flight, right? And stress, negative stress, puts us in that fight, flight, fright category. And very, very specifically, blood leaves from those central organs. And there's actually some studies, animal studies that have been done that indicate that whether it be an acute stress or something that one lives with on a daily basis like that these are rat studies that were done, that the amount of blood flow to the pregnant uterus can be reduced by as much as 65% as a result of stress. So sometimes, there's a lot of stressors in a human's gestation that you can't avoid. You lost your job. Your husband got deployed. Someone rear-ended you. Whatever those things can happen. But if you have the counterbalance of some very deep relaxation, we're talking about really taking the fight or flight and turning it completely over to the other side of, oh, I am so chill and I am so safe and I am so taken care of that I'm actually blissful, right? That goes a long way to counteracting those stresses. And so really, in my viewpoint, massage therapy, or at least some way in which a woman is receiving a extensive amount of skin stimulation, if she's got that in her family, if she's got that from her friends, we know, again, from animal studies and from some human reports, mostly from deprivation situations, that skin-to-skin contact is essential for human beings to live, much less to thrive, right?
Right.
And so it's an essential part of gestational development. Again, rats, pregnant rats whose mothers were not allowed to lick their own bodies while they were pregnant, those mama rats gave birth to more stillborns. More of their infants died. Their little pups died right away. Their mammary glands were were half the size of the ones who could lick themselves. I mean, the list goes on and on of the detrimental effects of that little mammal's lack of contact. And so either it can happen in the family, but it also can happen through appropriate therapeutic touch. That also is going to help relieve back pain and hip pain and improve one's breathing, right? And remember that a pregnant person is not just pregnant; they are also still the cello player that they are, or the engineer that they are, or the waitress that they are. So whatever the other musculoskeletal stresses are of their lives are still continuing on, usually, at least for most of us during our pregnancies, at least.
Right. Well, I mean, those are a ton of different benefits you can all get. Well, Carole, in our last couple minutes, tell our listeners how they can get in touch with you, or either if they're maybe a massage therapist that's listening that wants to learn more, or even more importantly, the pregnant mamas that are listening to find out more and possibly even find a therapist. Where can they reach you?
Yeah, well, probably the best place would be at my website, which is bodytherapyeducation.com. Okay. And on that website is a website that is primarily aimed at therapists who are interested in specializing in this work. So there's a lot about the courses that I teach and getting certified, and I have a blog that has a number of my articles that I've written over the years, how to buy my textbooks and those things. But there's also there's a section on massage services, which is about mine and my colleague who I share my office with. And there is also a resource listing of certified massage therapists. And it's not the complete list of people who I've certified. There are more than the ones that are on the website. So if you don't find someone on that website that is in your area, then another possibility is to just email me and let me know that you're looking for someone. And that resource, I've trained people around the United States primarily, but I've also trained therapists in Canada and in Great Britain, over in Scotland in particular. And then people have come from other countries. I've got to a handful of Japanese and German and French and someone down in Chile. And so there's people around, a few in Australia.
Great. Well, I'll make sure to include your website, and then also those other links in our show notes. So listeners, you don't have to write that down. It'll be in the links on the website as well as in the show notes.
Great.
And then Carole, so our last couple questions I always like to finish up my interviews with. And the first one's for the mom. Like, what's the major take home that you'd like them to have from our conversation? Whether it's something we talked about or maybe something we haven't talked about, what's that kind of main message you'd like them to hear?
Well, two that I've mentioned that I want to remind them of: do your homework and find a therapist who look for someone who's got at least 24 to 32 or so hours of specific prenatal training. Hopefully that's not just done online, that's done in person. Mm-hmm. So unless all you're looking for is just TLC. So education. And then the importance of having that this isn't just a frill, that this is something that contributes to your child's development. It contributes to your enjoyment and health as a pregnant client. And one thing that we didn't touch on that I think is particularly important to recognize is that there's quite a bit of research that indicates that when a woman is well cared for in terms of feeling nurtured and actually touched herself towards the end of her pregnancy and during her labor. She is going to touch her own child more fully. She's going to bring her child from fingertip touch into full molded embrace much quicker and much more fully. That there is more bonding and connection that happens between the mother and the baby. And that also applies to the partner, if the partner is involved with lots of contact. And so what that means is we have a family that's more connected. And when an individual family is more connected, that means that person, that child is going to grow up and is going to be more connected to him or herself, going to be able to make better connections out into their world. And there's a growing exponential of connection and peace and nurturance and understanding. And I think that's what the world needs now.
I do too.
Love, sweet love.
Yeah, that is beautiful. It is absolutely what we need. What about for the little ones that might be listening? I always like this question. For either the baby that's in utero still and listening through mama's belly, or a baby that's just been birthed into the world and listening through mama's ears right now on their chest maybe, what little piece of advice or encouragement would you like to whisper into their little ear?
Probably that same message, that there's much love and sweetness waiting for them. Mm-hmm. Whether it's from the person who is gestating them or the persons who are going to take care of them, and to ask for it, open themselves to it, be open to it, and there's much sweetness waiting for them.
That's so true. Well, Carole, thank you so much. I really appreciate you taking the time to be with us today and for all of the information that you shared. I know it'll be really helpful for our listeners. So thank you again so much.
You are so welcome. It was a pleasure.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.